Good morning. Let's start with our morning huddle. I want to start out by acknowledging that I appreciate each of you for all the work you're doing and for being part of our team. I have two quick updates. The first is that Monday is a holiday, so let's all check our schedules and ensure we have correct coverage. And the second is that our new time system is going live on Friday, so ensure you've completed your online training and are ready to use that system. Issues that arise can be shared at our morning huddle moving forward so that we can talk about any and remove any barriers. So let's move to any concerns or areas that you've identified for needing improvement. Ton, I noticed you've posted a concern with our daily oral hygiene expectations.
Thank you, Donna. During audits and chart reviews, I'm seeing that we're only attaining 40% of daily oral hygiene compliance for our residents. I think we need a tool for ensuring oral expectations are completed for each resident by noon each day.
So I have been reading about human factors and our ability to accurately recall all of the requirements in real time with so many different distractions. A tool that is ready reference to refer to and a visual reminder of what is or is not done may be helpful.
Well, I recently attended a Imagine Health learning series that introduced K-cards and visual boards to assist in real-time data and learning.
That sounds interesting. Megan, could you please tell us more?
Yeah, when I learned about K-cards, I found that K-cards can be used in several different ways. They can be used as a more of an audit tool where the results of the audit are tracked with red and green indicators. And another way they can be used as part of a visual tracker. I suggest that we use them in the situation as a reference guide to help engage the team, and we can track the results via a real-time visual board. The steps would include developing a card that is kept here by our huddle board and would clearly state all of the steps and the importance of oral hygiene. Our CNA team can use it when starting the process to ensure they check off all the steps. We could use a visual board to identify residents whose hygiene has been completed during the morning. Anyone walking by the board mid-morning who sees there are still residents needing their oral hygiene completed could ask if assistance is needed to ensure that the completion is done by noon. At our morning huddle, we can review the previous day's successes and troubleshoot any identified barriers that resulted in less than 100% compliance. I did know this topic was going to come up, so I've already drafted the Kamishibai card and the visual board for review and acceptance.
Oh, nice. Thank you.
We could create paper copies for CNAs to grab and carry with them throughout the morning as a reference for the steps that need to be accomplished.
So what if we find problems during the oral hygiene care?
Yeah, that's a great question. If there are any problems found during oral care, you can log it into the variance log and state what prevented you from completing it, or you can bring that information to our next huddle. Here's our visual board that upon completion of each resident's daily oral hygiene, the corresponding toothbrush will be moved on the board in the time band it was completed. After our morning huddle, we'll move the toothbrushes to the holding line and start the process over again.
This sounds really interesting. Is everyone on board to pilot this process to see if we can quickly become compliant with our goal of 100% completion of oral hygiene for all residents by 12 o'clock noon?
Yes.
Well,
I'd say let's give it a shot.
All right, excellent. Thank you. Good morning. Let's get started with our morning huddle. First, I want to acknowledge that I really do appreciate all of you and the work that you're doing and for being part of our team. I have two quick update reminders. Again, remember Monday is a holiday, so check your schedules and let's ensure that we have correct coverage. And then remember Friday, the new time system is going live. Has everyone completed the training?
Yes.
Yes.
No,
I haven't done it yet.
Okay, well, let's support Connie today to ensure we give her time to break away from her tasks and complete that training, okay?
Absolutely.
Thank you for that support. So let's turn to our visual board for oral hygiene compliance. Are the K cards useful to use? Has anybody have some success while doing your morning hygiene rounds?
Yeah, I work PRN, and having this available really helped me ensure I completed every step.
You know, I'm a traveler and your process is different from other sites. This guides help me keep things on track.
Well, that's great feedback. Thank you. Well, let's take a look here. We did great work yesterday on our oral hygiene compliance with some great improvement from 40% all the way up to 80% already. But it does appear that we had 2 residents who received oral hygiene after 12 noon, and 3 who did not have their hygiene completed at all yesterday. So let's identify the barriers and talk about that. Megan, could you please track these on the variance log for us? And we'll
Yes.
brainstorm some solutions as we go.
I wasn't able to complete Macy's care as she was out of denture cleaner and she has to use a specific type as a result of her allergies. I noticed that we had lots of extra floor stock of our normal brand of cleaner that we track, but that there wasn't a tracking system for backups of Macy's cleaner. Could we trial keeping one extra bottle from Macy and adding it onto our daily and weekly stock rounds?
I was unable to get to Mark and Alice as we had some additional needs for 2 of my other assigned residents, and I simply ran out of time. Then my shift ended early, so I did not complete my handoff. Could we trial having a buddy system for next time who could assist me with my oral care for my residents if I can't get to it?
I wasn't at huddle yesterday, so I didn't know that the expectation was for it to be done by noon. As soon as I was told, I quickly finished my assignments for oral care and then posted them as complete. But now that I'm aware, I will be compliant moving forward. I know a couple people were also on PTO the last couple of days. Can we add this to our communication book and mention it during our clinical huddles each morning and to each unit as a reminder?
Yes, thank you all. Those are some really good ideas for us to try, but it seems we need to make some assignments to ensure that those get completed. Kelly, as our lead CNA, would you please follow up and work with Central Supply to secure additional supply for the denture cleaner?
Yes, I can do that.
Thank you. I will talk with the unit manager to see how we can assign or introduce a buddy system for this. And then I'll also ensure we add a process change to our communication notebook. Is everyone supportive of these potential solutions and then moving forward with our pilot and debriefing again tomorrow?
Good.
Sounds
Yes.
good.
I think so.
Absolutely, yes.
Let's get 100%
Let's
tomorrow.
go for it.
Excellent. Thank you, team.